Good day. Welcome to Cold Lake First Nation, Legoff, Alberta. We're here at our newsroom, and we're here talking with Lillian at the nursing manager at the health center. We're here to talk about the COVID-19 and the pandemic that's affecting everybody around the world. And I just want to put fears to rest, about toilet paper. You don't have to buy toilet paper, so maybe I'll play a little clip about toilet paper.
We just opened the doors.
Going
Let's
and
see how
running out
long it
and
takes
buying
them to
out
get
the stores
through.
toilet paper supplies
And here they come.
is not something that's absolutely necessary when we're talking about the coronavirus. There are some things that you should really stock up on, and that would be, if you're on any type of medication, you want to make sure that you have readily available at your home at least 14 days worth of medication, so that you don't have to keep running to the pharmacy. You can stock up on some dry canned goods that don't go bad, so things like pastas and canned soups, those are always good to have on hand. Pet food and supplies, if you have any pets at home, we still have to look after our own pets, so that is another good thing to pick up. And just making sure that you have enough hand soap. A lot of people are making a rush on hand sanitizers right now. A lot of our suppliers are very low on hand sanitizers, and it's not necessary. Soap and water is actually our best form of protection against the coronavirus. So just making sure that you're washing your hands frequently before you eat, before you smoke, after you've been in a group setting where you've been shaking hands, after you've been exposed to somebody who's doing a lot of coughing or a lot of sneezing. It might just be the common cold, but it's still good hygiene to wash your hands frequently.
Yeah, so that makes me a question, like, when do I call 811? What's the difference between water droplets and airborne,
Okay, so I think we need to kind of go back to what the coronavirus is. So the coronavirus has actually been around. It's a group of family viruses, and they've been around for a long time. When we're talking about pandemic, COVID-19, this is in fact a new virus that we haven't seen in the human population before, and that's why there's so much hype and media coverage of this virus. So it's something that's new. Although that being said, we also know that in 80% of people, it is a mild form of the disease. So mostly just a cough, a cold type of cough, maybe a fever and feeling tired. So it's stuff that's manageable at home. It's not necessary in particular for everybody to seek out medical, doctors or nurses to look after this. You can easily do this at home. So drinking enough fluids, making sure you're getting enough rest. If you have a fever, you can take Tylenol or Advil, whatever you have at home to manage that fever. The coronavirus itself seems to affect mostly the elderly population who have comorbidities. So let's say you have high blood pressure or diabetes or cancer, where your immune system is already a little bit lower than the general population. That's where the COVID virus can, precipitate more severe symptoms, so the shortness of breath. And so this is why we're asking people, practice good hand hygiene. When you're out in the population, make sure that if you're shopping, if you're out touching different surfaces, if you're shaking people's hands, making sure that you practice good hand hygiene. Soap and water is sufficient. We've had, like I said, a lot of people call the health center asking for hand sanitizers, and I will tell you that we're not giving out the hand sanitizers because, in fact, your best line of defense is soap and water.
Just simply washing your hands all the time?
Washing your hands before you eat, before you smoke, after you've been out in the public. That is your general rule of thumb.
And it's not touching your face or mucous membranes?
Mucous membranes, yeah. So why is that important? Well, because the coronavirus is readily absorbed into the bloodstream through those mucous membranes. So from your mouth, so the lips, the gums, the nose, the eyes, when you rub your eyes, it can be absorbed through that as well. It is not an airborne virus, meaning it's not like something like measles, where if you're in the same room as somebody, 15 feet away, that you're at risk of contracting that disease. You can only contract the disease through droplets, meaning that somebody is coughing or sneezing actively, they expel the droplets, usually onto a surface, and then you come along and you pick that up. And we usually pick that up with our hands. And so, of course, if you walk away with that on your hands and you don't wash your hands and you go and you eat or you smoke, you're introducing that in through a mucous membrane. So it's a portal of entry into the body.
So don't share no smoking or anything.
Don't share your cigarettes, don't share your straws, don't share your pop.
Or even if you're vaping. Or
Yeah,
even,
but you know what? The same is true even when we're looking at influenza. And we are in the middle of influenza season. So these are really good instructions for any day of the week.
Yeah, I'm kind of confused because what's the difference from the common cold and coronavirus? Like, how do you tell it? Because like a lot of systems are.
It's very
same.
much the same. And so a lot of people are asking, well, you know, I got a cough and a cold and I want to be tested for COVID. Well, that's kind of not how it works. So right now, the guidelines in Alberta is if you have traveled in the previous 14 days and then you present with symptoms, so meaning that you've traveled outside of Canada to an area that has had high COVID cases, such as China, Iran, you know, Turkey, to those countries, you're at a greater risk. And that's actually where they're actually doing the COVID testing and screening. So if you present with those symptoms, a fever, a cough, severe difficulty breathing, then they will actually do what we call a nasal pharyngeal swab to confirm that you have coronavirus or that you don't. And so this is a swab that goes up the nose, and it's just a really quick swab that goes to the back of the throat. They swab and then they send that off for testing. But the only ones that we're testing at this time are those who have traveled and present with those symptoms. Now, if you're just the general public and you're sitting at home and you have a cough or a cold, you've not traveled and you've not had any exposure, we won't be testing those people at home.
Yeah, like I don't understand. They're saying stay away from the hospital and call 811. Can you
Call
explain
811. So part of our pandemic response here in Alberta is we have a system already in place, and that's called the Alberta Health Link. So Alberta Health Link basically triages people based on their risk. So if you're, let's say you're sitting at home and you have a cough or a cold and you're wondering, I wonder if I need to go to the hospital. So your first phone call should be 811. And what they're going to do is they're going to determine your risk, and they're going to, go through a complete algorithm. So have you traveled within the last 14 days? Have you been a contact of somebody who's traveled within the last 14 days? What types of symptoms are you having? Because it's possible to have a cough and a cold without having any fever. And we do know the coronavirus is usually accompanied by a fever. So you have to meet very specific criteria. And then if it's determined by 811, that you in fact meet those criteria, they're going to send you some very specific instructions. So they're going to say, I want you to go to this center at this time, and they will usually alert the center that you're coming in. Once you walk into the facility, you can identify yourself as having been sent by 811 for COVID testing. And most times they're going to isolate you from the general population just because we want to minimize the spread of the disease. And then you will in fact be tested. A lot of cases can be managed at home, so you may in fact then be sent back home to manage the case on your own. The only people that they would really keep at the hospital are those who are experiencing severe respiratory illness who need supportive therapy. So right now, there's no real treatment for COVID other than what I've already said, the fluids, making sure you're getting a lot of rest. So supportive therapy is in place for those who are at a higher risk. So our elderly population is particularly affected by COVID. So some of them who may be experiencing that severe shortness of breath may in fact be admitted to hospital for that therapy, such as oxygenation, right? For IV fluids, depending on if they have anything else going on within their body that can be treated at that time.
Okay.
Yeah.
Okay, what's the threshold for an elder? And and there's some people with a weakened immune system, and they're scared. Should they go anywhere? Like, how do they deal? Should they be scared?
They shouldn't be scared, but they should be aware.
Okay.
Right? You should be aware that if you have any of those comorbidities, whether it be hypertension or cancer or diabetes or COPD, that your immune system is weaker than the average person who doesn't have those diseases. And so it's important that especially important for you, to do exactly all those things that I have talked about. Avoid from shaking hands. Maybe come up with a fist pump instead, okay?
Footsies or something.
Or just saying hello.
Yeah. So I can't shake hands and I can't give my elderly ladies a spoon anymore. I'm sorry. So I'll just have to give you the elbow, but maybe not
The
too
elbow
hard.
bump, yeah. But also practicing, like I said, that good hand hygiene. It doesn't mean that they have to eliminate themselves from going into those
Just make sure you wash your hands,
Make
because
sure
I
you
went to the
wash your
washroom and
hands.
people don't even wash their hands. So please wash your hands.
soap and water, 20 seconds. That's more than sufficient.
Okay, as a council, it's my duty to advocate for my members and whatnot, and travelers amongst them. Like, where do I say stop? Should I say stop now?
Well, the best thing to do is actually, if you go on to the Government of Canada's travel website, they actually have a really good section there on travel advisories. And so they list actually all the countries and the risk level associated with those countries. So if you do have travel plans, I would encourage you to actually look at the website, identify where it is that you're going, and look at the risk associated with that. And really, it's a personal choice if you are willing to accept the risk. For myself, I know if I'm traveling and I want to go into, Algeria or China, I have to realize that the risk is very high, and am I willing to accept that risk? Yeah.
So if I went to the bush, I'll be okay, I guess. I went to the cabin for a month, 2 months.
There you go.
No, but I have a duty. I can't do that. But some people are talking like that, so.
Yeah, I don't think we're at that point yet. Really, in Alberta, if you're an Albertan, your relative risk is very low. All of the cases that we've seen here in Alberta thus far have been travel related. And I think we need to keep it in that context. It's not we have yet to see a community acquired infection, meaning that it's not related to somebody who's traveled outside of Canada. We haven't seen it pass from, somebody like me who hasn't traveled anywhere to somebody like you who hasn't traveled anywhere.
Yeah.
But that being said, we do expect that risk may increase or may change in the future.
So
that's why we're doing the planning that we're doing. And so a lot of people out there will notice that we're giving out a lot of information in relation to COVID-19. The health center prepared a lot of packages, and they're being sent out with our nurses and allied health professionals. We've provided them to the various departments to give out to the public, because I would rather that people have the information, the true facts and the true information, as opposed to what they see on social media and media in general. I think there's been a lot of hysteria around. That's probably why you've seen the toilet papers flying off the shelves. It's really unnecessary.
So in Alberta, there's been no community
No
infection,
community-acquired
just people
infections.
that were traveling and whatnot.
It was all related to people who were traveling, yes.
I'm not going nowhere for a while, so you can't blame me.
Yeah.
Everybody wants to blame Chief and Council traveling everywhere, but yeah, it's a serious. So I'm hoping.
Yeah, I think a lot of people are under the impression, just because it has been declared a pandemic, that things are going to change dramatically. And that's not how it works in healthcare. We are very much evidence-based, and we take a good, long, hard look at what is actually happening with the virus itself. And so you may not notice any changes at all in the way that our healthcare system functions for several weeks. It really depends on how much we see the COVID virus increase in the province of Alberta, and if we start to see those community-acquired infections. So again, just stay tuned and keep abreast of the most current information. The best website that I can direct people to is to the Alberta Health and Wellness website, and that has actually a full page dedicated to coronavirus. So that'll answer all your questions in regards to travel, in regards to what preparation you can make. If you need to be screened at all, it'll go through all that criteria right on that website. So it is actually a really good website to get your information from, as opposed to, the odd post on social media, which is really not reliable information. So again, we don't need to panic. This is a very mild disease.
It's updated daily?
And it's updated all the time.
Okay.
We actually have, get bulletins every week from Alberta Health. We've had, information sessions with both Alberta Health and FNIB, with our medical officers of health. And so we are kept abreast of the latest information. And if anything needs to change, we of course inform you guys of those changes.
Yes.
And then we give the information out to the community.
Okay, and then I've been getting a lot of calls for like is events being canceled. Maybe touch a bit on that.
So we haven't made any decisions in the way of events, but again, we have to gauge our own risk, right?
Yep.
So this is something that we will have to think about in the future as we see we might get more influx of this virus, and those are decisions that maybe will have to be made in the future. But as of right now, it's still the status quo. But just being aware that when you're going to these larger events or larger meetings, that you need to practice good hand hygiene, making sure that you are washing your hands, keeping your hands away from your face, your eyes, your nose, your mouth. And just making sure, if you are sick with a common cold or flu, it's common etiquette to sneeze into the sleeve, right, instead of into your hands, because that's how you're passing that along, is through your hands, whereas with your sleeve, not so much. And making sure if you are using tissues, and I see people doing this all the time, they have, pockets full of tissues, and they will not necessarily get rid of them appropriately. So making sure that you're getting rid of those tissues if you have them in your pockets.
No old socks yet?
No old socks yet, no.
Okay. So there's 14 cases up today?
14 cases as of this morning, yes.
Okay, that's March 11th.
And all travel related.
Okay.
Okay.
Thank you for coming out with us today, Lillian. But my parting note is make sure you wash your hands and do not touch your face, mucous membranes, and don't panic. It's just like a common cold. And thank you.
Thank you.